This week in Grace's Girls Club, we are taking a trip out to the Shoals. I want you to meet someone very special who, without even really spending much time talking to her, I can tell you probably has a pretty big heart based on her profession. So I'll let her introduce herself to you. Whitney, welcome to Grace's Girls Club. We're so glad you're here. Please introduce yourself, tell us your title and where you work.
Hi, I am Dr. Whitney C. Terrell, a small animal veterinarian and a partner at Connolly Animal Clinic in Florence, Alabama.
And we're so glad you're here with us. So, Dr. Terrell, walk me through the day-to-day of being a vet and what you see at a small animal clinic.
Yeah, so the best part about my job is that it's always different. Now I focus primarily on cats and dogs. So we typically see wellness appointments each day, but we also see numerous sick visits. So this can include things like ear infections, allergies, orthopedic issues, gastrointestinal upset, and a lot more. And then in addition to this, we also perform surgeries each day. These surgeries can range from your typical spays and neuters, but then also have mass removals, dental extractions, exploratories, amputations, and more.
Oh my goodness. Are a lot of your surgeries scheduled out in advance, like come in on a Tuesday, that's when we do surgeries, or are a lot of them emergency, I just saw this pet and I need to take them back to the operating room right now?
So the majority of them are going to be scheduled. We do have our, every so often an emergency that needs to be done right then. And we will kind of adjust the schedule as needed. But for the most part, they are scheduled ahead of time.
I gotcha. So I went to Mississippi State. We have a pretty big vet school there. And, I always knew that I respected vets and you had to be smart, but didn't really know a lot about it until I was in college and had friends that were in vet school. And let me tell you, not for the faint of heart. So of the letters in STEM, science, technology, engineering, and math, which of those do you feel you use the most?
So definitely primarily science, but when I say that we use every bit of STEM, I mean it. Not only are we involved with learning the science behind trying to prevent, treat, and diagnose and manage disease in our patients, there are numerous diagnostic machines that we have to learn how to work, clean, and unfortunately sometimes repair, even if it is a little redneck ingenuity. And then, not to mention all the calculations that we have to do to dose out medications, anesthesia, and fluid therapy.
Wow. So do you guys administer the anesthesia yourself during operating as well?
Yes.
So you're like a whole operating hospital room in one person.
We do it all. There's been like a little meme that has sent out that says, in human medicine, they have phlebotomists, they have anesthesiologists, XYZ. And in veterinary medicine, we often do it all. Now, thankfully, we do have licensed veterinary technicians that help us with a lot of those tasks. But yeah, in veterinary medicine, you are a just constant machine doing everything.
Wow. So I can see what you're saying then about how it's never the same. So let's say I was a little girl at home and I thought, listen, this is for me. I love it. I have to do the same. Walk me through educationally how you got to where you are today, but then also what advice you might have from an education standpoint for the next generation.
Yeah, so it's a long road, and it's a lot of hard work. So after high school, for me, I actually went and played volleyball at Northwest Shoals for 2 years. And then after that, I went to the University of Alabama, Roll Tide, to finish my undergraduate degree in biological sciences before pursuing my veterinary degree at the University College Dublin in Ireland. So I'm a little unique for being in Alabama, but having gone to vet school in Ireland. That typically takes about 8 to 9 years, depending on how long your undergrad takes. And then if I were to have chosen to specialize, which you can do in veterinary medicine, that could be looking at an additional, say, on average, 4 years. So you could be anywhere from 8 years to maybe even around 12.
Wow, wow, that is quite the commitment. So tell me who might be, or really what the characteristics of a good candidate for your field might be. So for meteorology, I would say someone who can manage their time well on TV. It's very fast paced. Someone who is very science and math brained, thermodynamics, calculus, physics, that kind of a thing. And then maybe someone who has a strong protector instinct for their viewers during severe weather. What might the characteristics be of someone who would excel in veterinary medicine?
Yeah, so absolutely somebody that loves math and science, somebody that obviously has a passion for animals. However, it's often a misconception that people who choose vet med do so because they don't like working with people. But to excel as a veterinarian, you have to enjoy and be good at communicating with your clients. A lot can be learned just from talking with the owner. So being a people person or being able to at least handle dealing with the public is crucial.
Oh, it's so true. Our family has always had dogs, and we had to put one down several years ago, and he had been sick for a while. It was the hardest process ever deciding when was the right time, you know? But our vet was right there every step of the way, and she was as much a doctor to us and our feelings and our needs in that moment as she was to our little Rocky. I mean, she was like handling both of us the whole time. It was amazing how she helped us.
Absolutely. We definitely play a lot of roles, not just in the practice itself, but often for the owners as well. So we are a therapist, sometimes unwillingly, but we are a therapist. You know, we're somebody that they can talk to, not just about their pet, but about their problems and stuff as well.
Absolutely. So, what was it that made you say, this is what I want to do? I want to go to school in Ireland for it. What was it that was so attractive about this field?
Yeah, so I mean, I wanted to get in this field for a lot of the reasons that I've kind of already mentioned. I loved science, I love math, I love animals, and I also love problem solving. So you develop into quite the detective when you become a veterinarian, and that really intrigued me. I also love a lot of crime shows, so that kind of helped me get a little bit of that detectiveness into my career. And then choosing Ireland, I have always wanted to get out and explore. I grew up in Alabama. I was born here, grew up here, and I really just wanted to get out and explore the world. Dublin has a vet school there. It's the only one on the island, and they are AVMA accredited, which means that you can go there and go through schooling, come back and take the NAVLE and still work in the United States. Not all overseas schools are AVMA accredited, but if they are, that allows you to take the NAVLE, which is our board exam, and come back to the States to work.
And I love that you said that. That even right there is kind of demonstrating the problem solving. There are so many people that wait for a shadow experience or wait for a study abroad. And you said, no, this is what I really want to do. I need to make sure I can do it in a realistic way where I can come back here and work. But how can I make this work for me? How can I blend some of these passions? And that's exactly what you did, which is a big part of the problem solving that we all have to deal with every day.
Absolutely.
So you kind of already touched on this in your first answer, but the best part of your job, if you had to pinpoint one or two things, what would you say it is?
So again, there's the best part of being a veterinarian, and for me, my job is bonding with the patients and the clients because you're not just treating the patient, you're also helping the client. And there are pets that come into the clinic that I can recognize from their bark, like not even see them, but hear their bark and know that's so and so. Um, and so knowing that and getting that bond, getting to know them, the seeing like their excitement to come to. Obviously, not every pet is going to be excited to come to the vet, but when they are and they're happy to see us, they recognize us, they're happy to be there. That's just one of the most heartwarming things. And then bonding with those clients, creating the good relationships, building that trust is so important to me. And I've actually had, quite a few of my clients become really good friends.
Wow, that's great to hear. So if that's some of the best parts of your job, what are maybe some of the biggest challenges that you have to face every day?
Yeah, so again, there's a lot of detective work in veterinary medicine. Our patients cannot tell us what is wrong or how they feel. So we do have to rely on the owner's interpretation of their clinical signs. We have to perform a physical exam and then perform any diagnostics that we are permitted to by the owner. This alone can come with a lot of challenges. Pets that don't want to be there or are reactive or aggressive can be very challenging. The owner's capabilities or willingness to allow us to perform the recommended preventatives, diagnostics, and treatments. And of course, having to constantly battle Dr. Google and unqualified online influencers that make recommendations that are not up to par with science or what we recommend in veterinary medicine. There is also, unfortunately, a high rate of compassion fatigue and burnout, depression, and even suicide rates in our field too.
Just because of all that's on you and having to wear all those hats and having to cater to that many needs day in and day out.
Absolutely. It's definitely multifactorial. The demand that we have to do, the amount of heart and soul that we put into our job, having to euthanize patients, having to deal with the public. And then there's a lot of financial aspects as well. There's a very high debt to income ratio for veterinarians. It's very difficult to get into veterinary school. There's a lot fewer veterinary schools than medical schools. And having to work that hard and go to school for as long as a human physician and then get out and oftentimes maybe not get the same respect that other human physicians would, and then get paid significantly less.
I like how you said that and your smile got bigger. That's very
Yeah.
funny. Um, a true injustice, and I really do mean that, a true injustice. But definitely respect how smart you all are and just the spectrum of all the different animals and the things you have to know for each one of them. So one last question for you. I do want to let you get back to your patients, but before you go, I want to ask if you have a piece of advice, any wisdom that you would offer to the next generation of young women hoping to be in the STEM field one day. What would you say to them?
Absolutely. We 1000% need more women in STEM and especially veterinary medicine. So, mentioning our human medical counterparts, it has actually been proven that female surgeons have better outcomes and patient compliance than their male colleagues, yet still on average earn less. So, maybe we can work on that in the future.
Mm-hmm.
Um, I do believe that those better outcomes have to do with our ability to listen to our clients, the compassion that we just, I feel like, naturally have, our attention to detail, and our exceptional multitasking. Veterinary medicine and STEM in general need more women who are willing to lead, persevere, and show the world what all we can do. Because, as a wise woman named Beyonce once said, who run the world? Girls.
Girls. I love it. I love it. It is so true. And actually, I've heard that statistic before about female surgeons. Unbelievable. And you explained it perfectly. I think your assessment is probably, and you would know better than me, but is probably exactly spot on.
Thank you.
All right. Well, I will let you get back to your patients, but officially welcome to Grace's Girls Club. And thank you so much for being here today and for sharing your expertise and your time with us.
Thank you so much for having me.
Have a great day.